So why this report now and what next? Well, this report neatly demonstrates that we face unprecedented change. We've got huge demographic demand, we've got financial pressures, we have a different health system. In light of all that, leaders need to step up to the plate. And leadership has done really well over the last decade or so, but the agenda going forward is different. So we need to build on the success of leaders, but we need to do things differently if we are to continue to improve patient outcomes and provide better services.
In these times of austerity, these times of needing to do more with less, innovation has to be at the core. And what I mean by that is not best practices in some part of the organisation or new ideas in some people's heads, but innovation everywhere, with the whole workforce, with all colleagues. I know from my own organisation as Pfizer that innovation is our future. Unless we change the things that we really believe that need to be changed and improve those things that really need to be improved, we will not be successful. And I think the same is true for the NHS.
My aspirations for the programme are that we're going to unleash the talents of the workforce of the NHS. We have to fundamentally believe that the workforce are capable of doing this, that they want to innovate, that they know how to innovate, and we need to make them understand that they will have two jobs, which is firstly to do their job, but secondly to improve their job. And innovation becomes part of the day job, it just becomes part of what we do.
So one of the tests of the Academy is how we ensure that we've got a cadre of leaders at all levels, not just at senior level, but mid-tier and as they enter the NHS, who have the skills and competence to work to the best of their ability within a framework, the NHS Leadership Framework, which describes how they can deliver services through better innovation, better improvements, through communicating well and working with their staff. So for me, the test is obviously around the impact on patients, but also from the Academy's perspective, how competent and able our leaders at all levels are to help transform services. So for me, it's about shortages in the leadership community, which we're seeing currently, making sure we address that, having a stronger range of talent, particularly from clinicians, and have really happy, successful staff. Well, the Leadership Academy is developing a core set of programmes based at entry level, mid-career and senior that will identify what leadership skills are required and will support hopefully thousands of people in the NHS in developing their personal skills, and in that way ensure we've got leaders at all levels who can innovate and improve their services. And in that way we'll develop an industrial approach to transformation.
Okay, if I had a magic wand, 3 actions, this would be my wish list. Number 1 is we need to recruit people with the right leadership behaviours for innovation. So we need to think about those behaviours when we are recruiting leaders at every level. Number 2 is about the money and how we incentivise innovation, not just in people's own salaries, but also how the money flows in the system. So for example, in my hospital, our innovative work with telemedicine to prevent admissions is financially not viable for us. We get paid when we admit, not when we keep people away. So the money needs to follow the innovation. And the third thing is, I think we use lack of evidence as a block for innovation. And actually, of course, there isn't loads of evidence on new things, and I think it is actually unethical and immoral not to do the innovation. So the third action for me would be about freeing up the block about evidence base.
I think culture is a very difficult thing to describe, and it's a collection of how people behave and how people feel. But if there was a culture where innovation was accepted, supported, believed in, recognised, I really do think that things could change for the better, and that has to come not just from processes and so on to support it, but from very strong and clear and consistent leadership.
First of all, we have to tell everybody that we expect innovation. We have to tell them we expect innovation. We have to tell them what that looks like and what controls there are around that and what their part in that must be and how they can move things forward. A lot of people have a lot of ideas, but they don't know they're allowed to take them forward. They don't have the framework or the culture already of everybody contributing to innovation, which you would see in a lot of successful private sector companies. If we can get that moving forward, then we need to reward people for doing that, reward people for taking controlled risks, and really reward people for copying. There's an awful lot of good practice out there, and the NHS is not good at sharing that. If you reward people for copying as well as coming up with new ideas, or reward people for adopting those ideas that have been developed by some other organisation, that can really help us spread things wider.
This is really important to me because I've been fortunate enough to actually see the future in work. I've been to Sweden, to a place called Jönköping, where they've been adopting this two roles attitude to work for the last 20 years. They've taken the work of an American guy called Deming and they've applied it. He's the guy that invented the Toyota production method effectively, and they've applied it to healthcare, and that's something that we should be doing over here. This is not new in the sense that it's this year's new model. It's been around for a number of years, and we just need to take it and apply it. We need to share and spread of stuff that we know works, and Jönköping is a great example of that.
So ultimately, why it's important to me, this is the heart and soul of what the NHS does. We've been a fantastic resource across the NHS for many, many years, but we do face huge challenges. So we're in a great position to be aware of that, to be planning ahead, and the Academy needs to be seen as an active agent for change, not just to develop individuals so they personally get on their career, but in doing so they deliver better care for patients.
Obviously this is important to me from a professional perspective. My organisation is there helping the NHS to move forward, to adopt new technologies, to think of things in different ways, but this is far more important to me as a citizen of the UK, if you like. I'm a user of the NHS, I'm a friend and a relative of users of the NHS, and it's a history and a service that we should be really proud of. We need to be proud of it going forward, and in order for that to happen, it needs to change, it needs to keep up. Danny Boyle did a fabulous job of celebrating the NHS, and I didn't hear anybody complaining on that night. I think we need to feel that pride, and we need to make sure we still feel that pride in 10, 15 years' time.